Hello, my name is Kaisha Morton. On behalf of Impact Austin, I'd like to welcome you to Issues Facing Central Texas Women as part of our Discovery Days 2021 series. Before I introduce our speakers, I'd like to tell you a little bit more about myself and my journey with Impact Austin. I'm currently a UX recruiter at Google and a leader of our Women at Google Austin's employee resource group. I joined Impact Austin because I'm passionate about creating equitable spaces for all, so I'm extremely excited for us all to participate in today's discussion. I'd like to thank our Discovery Day sponsors who made this event possible, C2C Media, Dockhand Realtors. Also, thank you to our leadership and philanthropy level sponsors. For those of you who aren't aware, Impact Austin is a local collective women's philanthropy group open to any female identifying person who wants to pool their resources to make a greater impact in our community. To date, one member at a time, Impact Austin has donated over $7.44 million to Central Texas nonprofits. Thank you to our past, present, and present members. Check out impactaustin.org for membership details, or you can just ask me. If cost is a barrier and you're still interested in being involved, please reach out to us. We'll be sure to find a way to make it happen, and we really hope many of you will join us. So a few quick reminders before we get started. You can use the Q&A function to submit questions. We will answer those questions at the end of the session, and we are recording today's session so that you'll be able to reference it, and we'll post it on the Discovery Days webpage for you once the program is over. Well, now I'm excited to introduce you to our speaker for today's session, Dr. Dena Jackson. Dr. Dena L. Jackson is the Chief Operating Officer at Texas Women's Foundation, where she has served since 2012. In this role, she oversees effective businesses, operations, ensuring a strong and capable team is in place to transform the lives of women, girls, and families across Texas, while also driving Foundation's research initiatives. Dr. Jackson has worked in the nonprofit arena since 2001, starting with Susan G. Komen Foundation training staff and volunteers around the U.S. to develop, manage, and evaluate local breast cancer programs. Later, Dr. Jackson opened both the Foundation Relations and Research Development offices at the University of Texas, Dallas during 5 years as Assistant VP of Research Development. As a native Texan, Dr. Jackson earned her doctoral degree in health studies at Texas Women's University. Without further ado, I will turn it over to Dr. Dena Jackson.
Thank you so much, Kaisha, and hello, good afternoon to everyone. I'm going to share my screen here so that we can all be looking at the same thing. There, you should be able to see that now. So once again, thank you, Kaisha, and to Impact Austin for having me here today to be a part of 2021 Discovery Days. And I'm really looking forward to sharing this information today around economic issues for women in Texas. But before we get started, I wanted to share just a little bit about the history of the Texas Women's Foundation for those of you that may be new to us. So we started actually in 1985 as the Dallas Women's Foundation, and you may know us as that. We changed our name in the fall of 2018 after a very successful 6-year, $51 million fundraising campaign. And we've been doing statewide work for quite a while, principally in research and advocacy, like what you're going to hear today. But we had continued to focus our granting in North Texas. Since changing over to Texas Women's Foundation, we are still doing that statewide research and advocacy, but we are also beginning to do some granting a little bit more statewide as well. We are a community-supported foundation with just over $43 million in assets. And we spend about $7 million per year specifically on some direct programming and granting. And this makes us one of the largest women's funds in the world. Our mission is similar in some ways to Impact Austin. So like I said, we are a community supported organization. So like Impact Austin, we believe very firmly in the role of collective giving and how that leads to collective impact. We also strongly support diversity. And it was interesting to hear Kaisha in the introduction say that Impact Austin membership is open to any women or women identifying individuals. And so we have made similar changes to our granting in the last 3 to 4 years. The grants that I give go out to organizations that serve at least 75% women and girls, but we did alter that definition of women and girl to be more accepting of those that identify as female. Our main focus areas are economic security and leadership. We focus on all of Texas. And we do this in 4 big ways: through research, which is what we're going to be talking about today; advocacy, we're going to talk about that a little bit too; granting, as well as programs. So the big piece of research that we have now been doing since 2014, we do it every 3 years, so this is the 3rd one, is economic issues for women in Texas. And so this piece of research focuses on what we consider the 4 key building blocks of economic security for women, girls, and their family. This report that you're going to hear today was published in June, so the data is before COVID-19 really changed our lives in so many ways. But it serves an important role as a baseline, really, that to reflect the lives of Texas women and families from before, so that when you look at what we're talking about today, education, childcare, health insurance, and housing, every single one of them has been in the headlines as stumbling blocks for families and really as stumbling blocks for our overall economic security of our state. I want you to use this information that you hear today really as a lens through which to look at current events. So when you read about eviction moratoriums, about childcare centers closing, workers not having paid time off and having to decide between safety and food on the table, think about the numbers and the stories that you learned today and how changes to these issues are a key part of opening up our economy as well as continued economic growth. The report has program and policy recommendations that are really even more valid now than before. And I know that Impact Austin is actually getting ready here in February to do your annual granting season. So I hope that this information is really helpful to you as you do that as well. What you see here are the 4 main sections of the Economic Security for Women's report. And you can find the entire report at txwfecoissues.org. And don't worry, I'm going to come back to that at the end of the presentation, and you'll see it on the screen, so you don't have to write it down right now. The information in the report comes from a very wide variety of public sources and peer-reviewed research, including the American Community Survey of the U.S. Census, the U.S. Departments of Labor and Health and Human Services, the Texas Department of Health, TEA, Institute for Women's Policy Research, Center for American Progress, and many, many others. There's actually over 240 reference citations throughout the report. So if you have any questions about anything that I say today, it's very easy to go and find the original source for that. And this Eco Issues for Women 2020 was authored by every Texan from right there in Austin, who have actually been the authors for all 3 of our reports. But let's start off with, who are Texas women? Now, over the past decade, Texas has grown about 19%, and the number of Texas women has mirrored that. What this means is that today there's just over 14 million women and girls who call Texas home. And so therefore, it's no surprise that women's financial security is essential to the continued economic prosperity of Texas. But if there's one typical Texas woman, she's a millennial, about age 36. She's a woman of color, lives in a big city, and is earning $35,000 a year or less. And she's also working to support her family. Texas is very diverse, and so it's really no surprise that Texas women are too. Here you see the changes in population by race and ethnicity since 2008. Now, while the largest percentage increase has been in our Asian population, growing 75% in 10 years, and that's the blue line you see all the way there at the bottom, Texas has seen the largest population number increase among Hispanic women and girls, with 1.3 million more Hispanic women living in Texas in 2018 than in 2008. And that's the green line there, second from the top. Now, today in this report, obviously we highlight the impact of gender, but we also look at the magnifying effects of race and ethnicity. A recent study at the Aspen Institute Financial Security Program showed, and this actually came out just in January, showed that cost and availability of stable housing and of quality childcare are considered major challenges to financial security. But the primary roadblock is structural racism. So therefore, it is imperative that policies and programs recognize the effect of this intersection in order to truly have the strongest outcomes and to have true social justice. Now, if you've ever been to a Texas Women's Foundation event before, you may have heard us refer to women being the face of poverty in Texas. And what that means now is that for a family of 3, they have an annual income below $21,960. And that's actually the 2021 number. That number changes every year, but it doesn't change by geography. So it really doesn't matter if you live in Dallas or Austin, Kingsville or Greensville, Waco or Brownsboro, all places with very, very different costs of living. Your eligibility for benefits is still based on that poverty line of $21,960 for a family of 3. In Texas, this means that nearly 1 in 6 women are living below the poverty threshold. And when you look here at the intersection of race and gender and on poverty, it is really clear that Hispanic and Black families, but particularly women, experience poverty at a significantly higher rate. To update these numbers just a little bit, in November of 2020, 20% of Texas adults who were living with a child, so many of these would be single moms, reported difficulty in affording adequate food compared to 15% nationally. Also, 40% of adult Texans reported hardship in covering their usual household expenses, once again compared to a lower number of 34% in the US overall. The only states with a higher percentage on these measurements were Louisiana, Mississippi, and New Mexico. Now, there's a really large section in the report on women and workforce, and I hope that you'll get a chance to look at it because workforce is really the overarching umbrella through which the 4 key building blocks build up into. And when women become moms, most do not stop working. 63%, or 2.5 million of Texas moms are working today. And Texas women also make up 63% of all COVID-19 frontline workers, which includes 88% of childcare and social services, 77% of healthcare, and 58% of building cleaning services. As you know, many of these are jobs that do not provide health insurance or paid time off, and many of these women also need affordable childcare in order to work. But let's go ahead and get started with our first building block, which is education, which we really see as a pathway to economic security and sets the stage for so much more success. Now, overall, Texas women are doing pretty well in education, with 1.4 times as many women as men completing public college in 2018. Now, since Texas Women's Foundation began reporting on educational attainment in 2014, women of all races have been more likely to both enroll in and complete Texas higher education than their male counterparts. Also, historically, Hispanic women have outpaced Hispanic men 5-4 in college degree acquisition. And for every 3 Black women with a bachelor's degree or higher, there are just 2 Black men. However, even with that growth, people of color are still underrepresented as students in Texas. As a percent of population, which is what you're looking at here, you see that only 17% of Hispanic and 27% of Black women have a bachelor's degree or higher, compared to white and Asian women, with 39% and 57% having a bachelor's degree or higher. And if you think back to that diversity slide from just a minute ago, it's really clear that when you leave out one of the fastest growing parts of your population, the meeting of future goals like Texas's 60 by 30 will be impossible to obtain. And as you know, that goal is to have 60% of Texans with some sort of post-secondary credential by 2030, so 60 by 30. That goal was actually set in 2015, and at that time, Texas had 41% with a some sort of post-high school credential, and the United States had just under 45%. By 2018, we'd made it up to 44%. And we'll have to see kind of what happens with the new COVID recession. We know that post-secondary training and education is important for economic security, but the gender wage gap exists even among college-educated men and women. And the effect of women being paid less than men for the same work is significant and over a lifetime, and it impacts future generations. Not only that, what you see here is that in nearly every category except for one, men with a lower level of education make more on average than women with one step higher level of achievement. So for instance, let's just go to the top, bachelor's degree compared to graduate degree. You see that men with a bachelor's degree make just a little over $67,000, and women with a graduate or professional degree make just over $60,000. And that actually holds true in every single line except for the associate's degree up to bachelor's degree, where men with an associate's do indeed make a little bit less than women with a bachelor's degree. So some of the major takeaways from education, and there's a lot more in the report, is that Texas women are succeeding in school at growing numbers, but they continue to earn less than men in every single occupation. We see that Hispanic women are the fastest growing parts of the Texas population, but they're still facing challenges as they seek to increase their educational opportunities. Now, in the report, like I said, you're going to see program and policy examples in each building block, but I'm going to hold on to those till the end today so that we can look at them all at once. Now, before I move on, I want to ask you all a question, and you're going to have some homework later on. In addition to research and programming and grants, the Texas Women's Foundation advances our vision for Texas through policy advocacy. And we don't do this alone, right? It takes everyone sharing the message with colleagues, friends, their church families, and their elected officials. So I think we're going to have a survey pop up here. And what it is, in the past year, how many times have you written or called or visited an elected official? It could be city council, school board, Texas legislature, Washington, D.C. Take a second, think back, past year, and we'll get your answers. And there's our results. Okay, so I have to tell you, you people in Austin are more active than many of the times when I do this poll. Either in North Texas, I've done it quite a bit for statewide, and the number that have in that 1 to 2 range is definitely significantly more than what I've been seeing. But we're going to come back. So keep in mind where you are, keep in mind where your sisters are, and we're going to have some homework later on. Okay, now let's move on. Oops, let me make sure that I've got my thingy going. I have lost the ability to move my, there I go, childcare. That's our next building block. Now, it seems to have taken a worldwide pandemic to finally bring the importance of childcare as a work support for working women truly of all income levels to the front page of the news. This includes early childhood education, after-school programming, as well as summer care. Now, the US Census's Household Pulse Survey found that between April and August of 2020, 10% of working mothers reported not working each week due to a lack of childcare. If we project forward and we say just 1% of working moms leave the workforce long-term, that will represent a federal annual $8.7 billion in reduction in family wages, and also a $1.6 billion annual in lost federal tax revenue. Based on what we're seeing so far, it's very, very possible that the actual number of women leaving the workforce for the long term is going to be much higher than 1% unless action is taken to support childcare providers and services. And when you look at that 8.7 billion reduction in wages, as you know, our economy overall is very consumer-based. And so that actually represents a lack of money that families are able to spend both on necessities as well as on other items in their life. Now, before COVID-19, there was 2.5 million working moms in Texas who depended on a wide variety of childcare. As you can see here, with just over 12.8 million people in the entire Texas workforce, okay, men and women, these working moms make up over 20% of our total workforce. A recent study by Child Care Associates in Fort Worth indicates that without additional business support, up to 50% of area child care centers, that's in Tarrant County, could close by this summer. And so with childcare already hard to find and to afford, the contraction in the childcare business will be an immense roadblock to economic recovery for families and for our economy. Now, this is another chart that we actually first reported on in 2014 that was a real wake-up call, because we hear a lot about the high cost of college, but we don't often think about the fact that the average year of infant care costs nearly as much. And these numbers are without any adjustment for quality. So you see over on the far left is our infant numbers, an annual year of infant care at 8,200 compared to a year at one of our great Texas state colleges or universities averaging in at 9,200. Now, for most of you on this call today, these childcare costs are probably considerably below what you paid, making that distinction with university costs even greater. Now, this year, I'm super excited about this piece of the report because we highlight the stories of 13 Texas women who share how the building blocks are impacting their lives. And I really hope you'll take the chance to go to the website, which is the same one where the report is, and listen to some of these powerful and diverse experiences from all across the state, because they truly tell the stories behind the data. And you know how important those stories are when we're trying to convince people of what's important to make a difference in our lives. One of the stories is from Christina, who is from Austin. And she recently moved to Austin with her toddler and became a part of a 2-generation program that provides a combination of quality childcare and early childhood education so that parents can work and attend colleges. And I know this is one that you all are familiar with because it is the Jeremiah Project, which has received Impact Austin money in the past. In her interview, Christina mentions the subsidy waitlist. So childcare subsidies, as you know, are federal dollars provided to low-income working families through the Texas Workforce Commission that help offset the cost of childcare. Over the past 6 years, the Texas Women's Foundation has invested over $2 million through our Bridge Fund, which is just one part of our Child Care Access Fund. This program provided childcare payments to families while they were on the state waiting list, and that allowed the mother to go ahead and begin work or go to school from day one while she's on the waiting list for the state to help her with the subsidy. During these 6 years, this subsidy wait list has varied from 2 years of 2 months to over a year. And so this has been a truly successful and exciting program. We are very happy that over these past years, the Bridge Fund has supported 616 families and 982 children, and has helped to support many, many women-owned independent childcare centers by encouraging families to select high-quality programs. And this year, in the spring, we're going to actually be launching a new childcare program around accessible and affordable childcare that is going to be focused not only on after-school care, but also on family childcare homes. And that will really be responsive to some of the large-scale issues we're seeing around COVID-19. Now, over 1 million Texas children could qualify for subsidized care, but fewer than 10% of eligible kids actually receive that care. Texas Rising Star is the state certification program, as you probably are aware. And what this picture is showing you is the real difference in access to quality care and actually to care overall throughout our state. And you see that all that white space over there in West Texas and in the Panhandle. Also, the colors here really tell a story about quality as well, with TRS 2, 3, and 4 being the salmon, purple, and teal dots, but the picture is really taken over by the khaki dots that indicate a lack of quality ratings, I suppose. That doesn't necessarily mean they are low quality. It means they have not taken the steps to apply for a higher quality rating. And this is something that is going to be in front of the legislature this coming spring. Now, finishing up our childcare building block, we know that childcare is critical, and it's a critical work support for 2.5 million working moms. We see that 48% of Texans live in childcare deserts, particularly in rural areas and Hispanic families. And we know that childcare is expensive, and it really impacts families' abilities to make other choices and investments in their lives. And I'm going to take a quick break. First of all, I'm a huge Alex Trebek fan, and many of you probably know that he did pass away this past year. So if we have any questions, we can take a couple of minutes here in the middle, And I think Kaisha is going to see if there's anything going on. And if not, we'll just move on.
No questions on my end.
Perfect. Thank you so much, Kaisha. Then we're going to say goodbye to Alex and we'll move on. And then we're going to have more time at the end. So if you missed this time, don't feel bad. Okay, health insurance, building block number 3. Now, health insurance, women in Texas are twice as likely to be uninsured as women across the country. And what this means is that pre-COVID-19, over 1.9 million Texas women lived without the financial shield of health insurance coverage. And this made Texas 50th in the country for health insurance coverage. Reports drawn from the U.S. Bureau of Labor Statistics by the Texas Comptroller indicate that possibly 659,000 Texas adults lost their health insurance in 2020 due to job loss, which is a 15% increase in the number of uninsured. Now, that number is not gendered, but it really gives you an idea of this additional scope of the problem facing Texas. Now, working age women are the most likely to be uninsured, and that's what you're seeing on this screen here, ages 19 to 64. Because many children, of course, are eligible for Medicaid or Children's Health Insurance Program, whereas women over 65 qualify for Medicare. And this really brings us to one of our next stories, which is Francesca, who faced challenges with health insurance coverage and postpartum depression after the birth of her son. Now, Francesca was fortunate enough to be connected with a nurse family partnership program that really helped her navigate the being a new mom and connecting her to resources. This is a national model that has been shown to be highly, highly successful in improving both the physical and mental health of mothers and babies, of reducing child abuse and neglect, and also of increasing the economic security of families. Moms that participate in a home visiting program are more likely to be back at work 1 year after birth than mothers who do not. This is actually an area where Texas is progressing well and is providing additional state supplements to federal funding. However, only 2% of eligible children under 3 years old are served by a home visiting program like Francesca and her son. Nationwide, that number ranges from 0.8% up to 23.7% of children 3 and under that are served by home visiting. So we're definitely on the lower end of that spectrum. Now, going back to our race and gender issue, women of color experience the highest rates of being uninsured in Texas, with around 1 in 4 Hispanic women and 1 in 7 Black women being uninsured. Black women receive prenatal care at a rate of almost half that of white women in Texas, while Hispanic women are a third less likely to receive prenatal care. One of the outcomes of that, Black women in Texas are at the greatest risk for pregnancy-related death and are more than twice as likely to die during pregnancy as a white woman. This is the case in Texas and actually in the nation as a whole, and is regardless of income, education, marital status, and other factors. I mean, many of you read about the issues that even Serena Williams had around her problem pregnancy. Yet most pregnancy-related deaths are preventable. Texas is one of only 12 states that has not expanded Medicaid coverage since Oklahoma and Missouri, both very red-leaning states, expanded Medicaid last summer. But a woman is eligible for Medicaid coverage during her pregnancy and for 60 days afterwards. However, in 2018, the Texas Maternal Mortality and Morbidity Task Force determined that 80% of pregnancy-related deaths could have been mitigated simply by extending that coverage from 60 days to 1 year. This came up in the Texas legislature in 2019, made it through the House, not through the Senate, and it has already been reintroduced again this year. When we look at health insurance coverage from 2013 to 2016, the uninsured rate among women in Texas actually improved by 5 percentage points, with 600,000 gaining health insurance. And that is when the Affordable Care Act really kicked in. However, from 2016 to 2018, the number of women without health insurance coverage rose again. And this was essentially due to efforts to chip away at and confuse the benefits available through the Affordable Care Act, which resulted in 200,000 more Texas women becoming uninsured. We saw this again this recent fall with a lack of investment in navigation programs that help women and families understand how they can access health insurance through the Affordable Care Act. So closing on health insurance, we know that Texas ranks 50th in the nation for insurance coverage for women, and that women of color are particularly hard hit. We know that the Affordable Care Act started to move the needle on health coverage for women in Texas, but that governmental support of that program has resulted in backsliding. And we know that the lack of health insurance and expanded Medicaid is especially felt by new moms, and women of color have unusually high levels of maternal mortality and morbidity. There are other issues related to health insurance and healthcare, such as paid sick leave and medical debt. These are both covered in the larger report. But now we've got our last building block, and this is actually the focus of Texas Women's Foundation's newest area of focus, which is housing. And we're actually doing housing stability. Once again, it's another issue that has moved to the front page, with job losses and furloughs endangering women and families who now may be facing eviction, which was already really high in Texas. Now, traditionally, as you probably know, the rule of thumb is to spend less than a third of your monthly income on housing. When a family pays more than that, they are considered housing cost burdened by HUD, meaning there may not be enough money left over for essentials like groceries, medicine, transportation, and of course, that childcare we talked about a minute ago. The growing cost of housing in this state means that 1.3 million Texas homeowners are burdened by housing costs, as are 1.7 million Texas renters. Now, there's a lot going on this slide as we once again look at the intersection of gender and race and family structure as well. So if you go over to the left, you see the lowest rates for housing cost burden, which makes sense, right? Those are married couples. They have the opportunity to have two people in the workforce. But you notice even in that area, families of color are twice as likely as white families to be housing cost burdened. Black Texans is the yellow bar across the entire screen, and they have the highest rates of housing burden across all family types, but this is particularly true for Black single women as well as Black mothers. Now, like childcare, eviction's been in the news a lot recently, with eviction moratoriums and as many more families are losing their jobs and new opportunities are scarce. In Texas, prior to COVID-19, the eviction rate was 2.17%. What that means is out of 100 renters, a little over 2 are evicted every year. What that resulted in was over 206 evictions every day, with Fort Worth and Corpus Christi actually having eviction rates that were double the state average. To put that in perspective, California's eviction rate is just below 1%. And I'm pretty sure none of us would consider California as a cheap place to live. And the difference that we really see here is around tenants' rights protections and landlord rulings. And eviction is a highly, highly gendered issue, as women with children are the most likely to receive an eviction notice. And while we may first think of eviction as the result of rent non-payment, there's actually many other causes, like damage caused to a unit by a domestic violence abuser, children acting out, or a landlord decision. Evictions result in homelessness, school changes and non-attendance, court records, bad credit, and job loss. It is truly a two-generation whole family issue. Evictions make it harder to find subsequent housing and result in a downward spiral to lower and lower quality housing. Evidence shows that they have a disproportionate impact on families of color, with 1 in 5 Black women and 1 in 12 Latinas reported having been evicted at least once as adults, compared to 1 in 15 white women. Now, there is no national or statewide tracking system for evictions. This is done at the county level. So we don't really have a number that can say this is what has happened since COVID-19 has come into play. However, the Eviction Lab at Princeton is tracking 27 communities that have systems that allow them to compare across city on the tracking of reporting of evictions. From March through December, there's 3 cities in this 27 cities that Princeton's doing. So it's Austin, Fort Worth, and Houston. From March to the first week of December, There were 725 evictions filed in Austin, compared to 9,266 in Fort Worth and 18,229 in Houston. Now, Austin is smaller than Houston, but not smaller than Fort Worth. And the difference that you really see there is additional tenant protections that are available in Austin and in Travis County that just don't exist in the other cities. This quote here really brings home, I think, the intersection of race and gender around the issue of eviction. We hear a lot about the crushing impact of mass incarceration on Black men and neighborhoods of color, but not on eviction and Black women. If you've not had a chance to read Dr. Desmond's book, Evicted: Poverty and Profit in the American City, I highly recommend it. It is extremely readable. And as an alternative, you can Google Desmond and the name of the book. And there's several interviews with him. They last about an hour. When he got the National Book Award and the Pulitzer, there are really good interviews with him. And once again, I highly, highly recommend the book. Now, this report has a lot more about housing, domestic violence, eviction. There's information on home buying and mortgages, and even on the role that transportation distances play on job type and salary and income. So I hope that you'll have the chance to look at the report a little bit more. But now we're kind of done, and you've got a lot of information. So what do you do next? What can you do? First of all, I think to really avoid being overwhelmed, think about what resonates with you the most. Is it the lack of health insurance and high maternal mortality? Is it the power of education to save lives? Maybe you think back and you remember how hard you looked for the perfect childcare center, and how when you found that high quality center, it made your life easier and helped prepare your child for the future. The Texas Women's Foundation is keeping our eye on these issues and on different types of legislation around childcare, student debt, tenant and landlord regulations, as well as health and insurance advocacy and health insurance access. And these are all included in our advocacy portfolio that is actually going to be approved by our board of directors next Wednesday. So I don't have it fully out for you just yet. The legislature has a lot on their plate, juggling a virtual world and what is it going to look like, redistricting, and needless to say, a revenue stream that is not quite what we were hoping for 18 months ago. For health insurance, like I said, the biggest issue left over from 2019 is extending Medicaid coverage for new moms from the current 60 days up to 1 year. There is certainly a cost related to this, but the issue of racial disparities in healthcare has been so clear around COVID-19 that we are really, really hopeful something will pass this time. And there is also actually much more talk about full expansion of Medicaid than there has been probably ever. In housing, we're going to be watching over the next few months, what's going on with the area of evictions. As you know, the national eviction moratorium has now been extended to the end of March, but it's really important to keep in mind that while there's a moratorium on evictions, people's rent continues to accrue. So by the time we get to March, there have been off and on, and probably more on, eviction moratoriums for nearly a year. And so if you can't pay 1 month of rent, pretty sure you can't pay 12. So any sort of federal support in this area is really going to have to take into consideration not just renters and homeowners, but also landlords, and particularly smaller, what are considered mom and pop landlords. We're really going to be paying a lot of attention to stronger tenant protections, a tenant bill of rights, and legal aid funding for tenant mediation. In childcare, this year has shown us very clearly that an effective childcare system is a true investment in the current American workforce, as well as ensuring a strong future. And this includes positive impacts on maternal education levels, labor force participation, and parental income levels. This system must work for all families, and it also means that it benefits employers greatly. Now, these policy changes, coupled with other public-private partnerships and philanthropy, can go a really long ways towards ensuring fair and equitable opportunities for all Texans to reach their full potential. Texas Women's Foundation is already funding a lot of this through, I mentioned, our Child Care Access Fund, Healthcare Access Fund, which we started in 2017 after this version of the report, and then my brand new one, Housing Stability Funds. But these are large and systemic questions that, I will be very honest, Texas Women's Foundation does not have enough money to solve these. Impact Austin does not have enough money to solve these. and we require policy solutions to have a truly sustainable impact. So your homework. First of all, I would love to invite you to so you can go to txwfecoissues.org. It's there, it's the bottom, and sign up for our Army of Advocates, because this is where you're going to receive the most up-to-date information on actions that you can take easily and physically distanced to support women and families in Texas. We do about 1 email a month. Every email is focused on a specific policy issue and then provides you with links for more information, as well as links on who you need to contact. Is this a city council issue? Is this a state legislature issue? And obviously, we're really going to be focused on the state legislature this spring. Also, at the same website, go and take a listen to just a few of the 13 stories that we have around Texas women. And actually, it's 12 stories, because one is a mom and her daughter in the I forgot the name of the program, because you have it in Austin as well. Caramia, I believe. It's there in El Paso. Next, I have 2 more ideas for you on ways that you personally and with your businesses can work to advance civic engagement and voting. First of all, work with your HR departments and executives to implement giving employees 4 hours paid off for voting. This is a very clear and proven action to increase voter representation. Recent elections have shown that citizens in Black communities wait 29% longer than other voters and are 74% more likely to wait more than 30 minutes. As of 2018, 44% of corporate HR managers and their companies gave paid time off to vote. And that includes the Texas Women's Foundation. Also, in late 2020, Coca-Cola, JP Morgan Chase, Best Buy, and The Gap all announced that they were giving paid time off for voting, and in addition, would not schedule meetings on election day. It's a pretty small thing, right? But it can really help make sure that nobody has any excuses for not voting if they waited all the way to election day. Paid time to vote increases engagement for hourly workers who would otherwise lose money to vote, and it can actually decrease wait times for all of us at the polls, as fewer people would have to squeeze into those little couple of hours in the morning or at the very end of the day. Second, back to your homework. I want you to commit to contacting your elected officials at least 3 times this year. We're at the beginning of the year, so it's going to be easy. You can give your opinion on a bill or a city law. You can ask for their opinion on something that you care about, maybe share some state stats that you learned today. You can just say thank you for a vote or thank you for their service. All of that is appreciated, and they need to hear from you. They need to hear from all of us so they understand what we really care about. Phone calls are easy and quick. Emails are great. Social media, kind of depends upon who you're following. My city council guys on Twitter all the time. It's very easy, but others, I'm actually going to do a direct email to them. So that's all I've got for today. I'm going to stop sharing my screen in just a second. You've got txwfecoissues.org down there. You've got my email address. And if you have any questions, you're certainly welcome to reach out to me directly.
So we have a couple of questions for you. The first question is, what can we do to advocate to the legislature for the need for better healthcare for Black, Indigenous women and mothers and people of color?
So this, like I said, this bill has already been announced, particularly around maternal mortality. But I think what you're also asking about is just the access of healthcare. I mean, if you were to look at where healthcare deserts are, there's really big parts of Texas that do not have healthcare clinics at all for any type of healthcare. So I take you back to look at our report online. You will also in the report see the link to the Maternal Mortality and Morbidity Task Force that was published in late 2018. And go back to what I said, call your state senator. It is really the crux, I think, right here. The House of Representatives most likely will pass it, so I would certainly reach out to them as well. That body changes people every 2 years, right? But reach out to your state senator. And when you contact a legislator, first of all, you need to be perfectly comfortable talking to their staff. It's going to be some charming, probably 21-year-old intern person who is so passionate, and they will take your message and they're going to listen to what you have to say. So don't be dissed if you don't talk to the elected official themselves. And it's really short and sweet, right? This is the issue I care about. Make it personal if you can. Or provide a stat, and then ask what you want them to do. You do not have to be the world's biggest expert on all of these issues, but by participating and giving your opinion and using some facts or some personal feelings, you're going to get your message across. Anything else, Kaisha?
Yes. So the next question, which legislators are most effective to lobby on these issues?
So I do not have a list of that with me. And I'm trying to think, there's several that are particularly big on healthcare. My own state senator, Nathan Johnson, is the lead. And actually it's a bummer because I do have who's just put that bill forward. What I can do is send it to the great ladies at Impact Austin. I'll send you the Senate bill number, and that way you'll know what's coming up. Look and see who signed on. So that's the first thing. But the other thing you want to do is, so if it is healthcare, who's on that committee? So you want to do your own representative for whomever you are a constituent of. That's very important. But then look at the committee. So in this case, Health and Human Services, right? And those are the other people that it's going to go through them first before it actually gets to the floor of the House or of the Senate. So always your own person. And healthcare is tough in Texas because of the way our state tends to be much more Republican than Democrat. Healthcare has become very partisan in recent years. And sometimes we may think that it doesn't really do any good to reach out to someone that is not going to listen, or that we think is not going to listen to our points of view. But I really encourage you to continue to contact your elected officials, regardless of which side of the aisle they sit on, and make sure they do understand the importance of this issue. I think healthcare is going to be very different this year because what we have seen is access to health insurance and even things like paid time off is a public health issue, right? Because without paid time off, without adequate healthcare, people are afraid to get tested for COVID-19. They're afraid that they would have to quarantine afterwards and be out of work for a couple of weeks and not get paid for that time. They are afraid of surprise medical bills, and therefore they don't want to get tested. And what that means is, what we're all finding out is that there are people that are ill that have COVID-19. They may not know it, or they may be suspicious about it, but they have to continue to work because of our situation. And so they're taking care of our children. They're taking care of us at the grocery store. They're serving our food if perchance we go to a restaurant, which it's been a very long time, I know. But I think that the collusion of COVID-19 is really going to help us advance healthcare in Texas. And to be quite honest, the fact that Missouri and Oklahoma both passed it last summer. It was a vote. It was a ballot issue. We can't do that in Texas. We don't have ballot issues around that sort of issue. But we have two very, very red states that said, Medicaid expansion is good for our citizens and it's good for our state economically. And I think that the arguments are super strong for Texas as well.
Thank you so much. Another question for you. Is there a petition to support the legislation on the floor for this cause?
Can you tell, is it healthcare?
They didn't specify.
Okay. So I think there's a couple of different ways to look at it. So for healthcare, it's not really a petition. It's that bills have already been introduced. So there are thousands of bills that are introduced every legislative session. And I think on opening day, there was already 550 or something like that were introduced. And so the Texas Women's Foundation works through what we call policy partners, okay? Because at my office, I do some policy advocacy. I have my VP of programs does some, but that's it. And we are generalists, right? Because I've given you all ideas on things that we care about: housing, health insurance, childcare. We work with policy partners in the community that live and breathe this every day. So for instance, if you care about healthcare, who I follow and who we get our marching orders, so to speak, from, is the Texas Women's Healthcare Coalition. And by working with them, they follow just healthcare. And they also know when a bill is good and when a bill is not so good, because there may be something that gets put forward. This happened a couple of years ago around predatory lending. My partner there is at Texas Appleseed. And so a bill came forth to help restrict predatory lending in Texas. And I thought it was like the best thing since sliced bread, right? This sounds fabulous. It's a great idea. But when I take it to my policy partner who lives and breathes predatory lending, they're like, okay, it sounds good, but see this sentence right here? This is a poison pill. We don't want this. This is not good. And so by going to these experts that live and breathe it all the time, that's what's really helpful to us. For housing, my brand new grantee for housing stability is Texas Housers, which is a statewide policy advocacy organization around housing. Like I said, predatory lending, we do Texas Appleseed. For healthcare, my primary focus is Texas Women's Healthcare Coalition. For, for education, Early Matters Austin is one that you should probably take a peek at. There's Early Matters Houston, Early Matters Austin, Early Matters Dallas, and these are, I serve on the board here in Dallas. It's a coalition mostly of corporate and business owners. Why is early education and education overall important to business? It is super important. So they have really good information as well on the legislature. And I know I'm leaving somebody out. Let's see, childcare, housing, healthcare. Education also, student debt, student loan debt. There's interesting stuff going on there. And a very exciting organization that's doing a lot of work in Texas is the Young Invincibles. And there we are looking at the opportunities for student debt forgiveness, as well as going back to that predatory lending, specifically focused on student debt. Some new requirements for financial education and navigation and guidance for these students who may be going through the loan process all by themselves. They may have a family who is not experienced in loan documents and in banking. And we see predatory lending taking place around student loans, just like we do in payday and title loans. So I think going to a strong partner, and then my last big partner, Texas Tribune. Okay, right there in Austin. I'm sure you could, if we were in a room, you guys would raise your hand and say how many had been to Trib Fest, right? So we use the Texas Tribune website to track bills, as well as a great way to get in touch with elected officials. And you will see that in every one of our Army of Advocates, because I like the Tribune's information on elected officials, because they don't just give you the official email page where you fill out the little form, but they give you their Twitter and their Facebook and the name of their office manager. And you can find anybody you need so that you can get to the right person. Is there anything else, Kaisha? I know we want to leave time for Impact Austin to say goodbye, I think.
Yeah, I think maybe just one more question. What are some ways that this research has supported Texas Women's Foundation's granting?
So we've been doing research for a long time. And at first, we have to say we did a piece that was rather wonky, and it was a gendered analysis of the Texas state budget, because obviously how you budget your money, raise money and spend it, indicates your beliefs around diversity and equity. It's kind of dry. So the economic issues report that we've now done 3 times really drives what I've talked about, like our childcare fund that we did. So in 2014, we did this research. We looked at some of these impacts of childcare subsidies, the expense of it. We were able to present this to a group of donors who said this is unacceptable. And it really changed minds and brought issues to light. I said we'd spent $2 million on the Child Care Bridge program in the last 5 years. Child Care Access Fund has actually resulted in about $4.5 million in investments in Texas, and it really all started with this research. We followed that up in 2017 with healthcare, and then my housing one, which, believe it or not, I had already planned to focus on housing stability in November of 2019. So before COVID-19. It helps educate us at the Texas Women's Foundation, because we want to know what is the real issue in Texas, what are the holes, and where can our money do best. And it helps us share with people like y'all, with Impact Austin, with donors, and with legislators. In 2017, every single state representative and state senator got a copy of our report. We have visited Austin multiple times with this report, and we also visit locally here in the North Texas area and in other places around the state. So we use it. We take it with us to elected official visits. We share it with donors, and it helps make sure that our granting is focused and is an area of greatest need. And like I said, the report is online and you are welcome to use it, share it, quote from it, just give us credit. But we do not want it sitting on a shelf. And I think that's the biggest benefit of this research for Texas.
Thank you so very much, Dr. Dena Jackson. I think that's all we have time for today. I know I really enjoyed hearing from you and learning so much about the work that your org is doing. Thank you to all of the attendees for joining in. We encourage each of you to attend the other Discovery Day sessions to learn more about Impact Austin. And we hope that you enjoy the rest of your day.
Bye, everyone. Thank you.
Bye.